My good friend and colleague, Dr. Vincent Rajkumar, and I had a debate yesterday about the value of the medications we're using for the treatment of multiple myeloma. Now, obviously these medications are very expensive, and sometimes the administration of these medicines will exceed $100,000 per year. Now, because of that, people are concerned, and rightfully so. We need to make sure we're getting in return what is being paid for these medications. Now, I have taken a stance, and based on my analysis of the situation, that in fact we need to be very careful when we talk about value and don't conflate that with cost. These are two different things. So cost, of course, is what you pay, its value is what you're getting in return. And so we went through the pros and cons, and like Dr. Rajkumar, I share some of the concern about the high prices of drugs. And he and I actually have surprisingly more agreement than disagreement on many topics. So for instance, he and I think that generic medications should be very inexpensive, and that today's best is not good enough. The real crux of all of this is what to do with the branded medications. So I presented some data that supports a couple of notions. First of all, patients can get their medicines. It is a common narrative in newspaper articles and even medical articles that patients are having a hard time getting these drugs because of the co-pays. But I did break down what the problems are there. And the only big problem we have here in the United States is in patients who have Medicare who cannot get direct copay assistance and have to go through a third party. I did show two studies that show that the copays associated with these medicines are almost always less than $100 per month. So patients can get that. And I touched briefly also on the issue of bankruptcy, which has often been cited as a concern. However, I made the very specific point that there's not a single study that has ever linked copays with bankruptcy. There's a lot of expenses, and probably more important, if you're a cancer patient, you and perhaps your caregiver cannot work anymore because you have to be focused on care. So if you have limited savings, that is a problem. The second part was value. So I actually went through the studies that have looked at this in a scholarly way. And even when these medications are expensive, they give us a lot in return. Now, we don't have time to go into all of those details, but just let me tell you one statistic. In the journal Cancer last month published a paper that stated that from 2010 to 2015, cancer mortality dropped by 1.5%. That may not seem like a lot. Of course, we wish it was much more than that. But still, 1.5% has been estimated by economists to have a net value of $750 billion. If we had the cure for cancer, for all cancers, that would be worth $50 trillion. And we did not spend anywhere close to that in the care of patients during that period of time. So my point was, I think there's value, but we need to be nuanced, we need to be careful with the analysis. We're all concerned, want to maximize the value we get in return, but I don't want us to throw the baby out with the bathwater.